Thank you for joining us on Highly Detailed News Interviews. We have with us today Rachelle Gordon. She is a Minneapolis-based freelance writer and tireless educator in the cannabis space. She has dedicated herself to informing others about the powers and potentials of plant medicine. She has also had her writings featured in Cannabis Now, as well as High Times and Cannabis Tech Today, as well as several other industry publications. She is currently working with Green Flower Media as a content writer, and we are incredibly lucky to have her joining us today. How are you doing today?
I'm well. Thank you so much for having me. It's a true pleasure.
No, absolute pleasure for us as well. Let me get this lit up real quick. Was there anything that you wanted to cover briefly that we missed in the interview? Anything you wanted to say before we get going?
Just that I can't wait to get lit virtually with you today.
Right? It's unfortunate. We would really, really love to do it less virtually. And so we're happy that you're able to be in California and really able to do this and enjoy it with us today.
Yeah, absolutely. I'm blessed. I have a joint of some Crossroad Chem from IC Collective, and I put a little bit of live rosin, super sour diesel from Doc Greens. So shout out IC Collective and Doc Greens,
Yeah.
and next level delivery for hooking it up. So yeah.
Awesome. There you go. Yeah. I'd say we're so lucky to have some friends around. So we're doing pretty well ourselves. But I guess we'll dive right in. People don't often hear about the cannabis experience in Minnesota. If it is possible, can you briefly explain the process of how one would actually acquire a medical cannabis license to follow the laws of your state?
Sure. So in Minnesota, we have an extremely restrictive medical program. It's a lot like New York State's. We have 2 licensed producers, no flower. It's only vape cartridges, tinctures, topicals. I believe we're starting lozenges and we have capsules as well. We're trying to get we're trying to get flower on the program, but it's been a little bit of an uphill battle. The number of qualifying conditions is fairly limited. It's typically only very, very serious life-threatening conditions, although they have been adding more conditions as of late, including chronic pain. And essentially, to get qualified, you have to find a licensed physician or nurse practitioner who is willing to qualify you. You pay a fee, and if they qualify you, then you'll pay another fee to the state, and you will have a license, and you can visit one of, I think there are 8 or 10 dispensaries throughout Minnesota. So it's a little bit difficult to get on the program. The medicine's a little bit difficult to obtain, but it's there. We're happy that it's there. It's a work in progress.
No, definitely. Just to follow up on that, are there still a lot of kickback on medical professionals themselves issuing those licenses, so they're just not having them available? Or are people starting to see it as an opportunity to help people in alternative ways?
I think that more and more clinics and healthcare practitioners are catching on to the potentials of this plant as a medicine. However, it's been really slow going. And unfortunately, a lot of the physicians just aren't well equipped with adequate information. And so therefore, they don't necessarily feel comfortable prescribing or talking about the plant since they don't actually have any peer-reviewed evidence to be able to showcase, what is possible. So I believe, though, as legalization continues and more research comes out and the medical community begins to see the possibilities here and see the science behind it, I think more and more we will see physicians willing to prescribe.
Yeah, I think that's definitely the case because we are starting to see some peer-reviewed studies come out. They are very limited usually in their scope, but they are starting to be generated. So hopefully we can see more and more of that as we move on. Let's say you've also been able to live internationally. How did you find the cannabis culture abroad compared to the States?
It's very interesting. So I was an au pair in the Netherlands when I was 20, and I lived a little bit north of Amsterdam, but spent most of my weekends in Amsterdam. And yeah, the culture there, especially at the time, was very, very different than it was here. This is way before we had any sort of adult use legalization anywhere in the States. But it was still kind of the same idea in that we are together in this community for this plant, and very much open and tolerant, and some of the same traditions that we see here in America, but just laid out in a much different way. Obviously there the public consumption within the coffee shops, of course, is part of the culture, whereas here consumption lounges are only just starting to kind of be a thing. And so you see a lot more conversations and kind of communal gatherings as far as in Amsterdam with the coffee shop culture there. There is a little bit of smoking out, in public, but it's typically, shied away from. We try to be respectful about it, just like, here in America as well. But clearly things are slightly more tolerated there than here, whereas public consumption is, technically illegal for the most part.
Yeah, it's interesting to see the difference between smoking cigarettes and smoking cannabis on a lot of different locations. You'll find, luckily in California, there isn't a lot of distinction in certain places, but it really just does depend on where you are, and in what establishment you are. It's very, very varied. Uh, we'll see. Hopefully it changes. Right now, nobody's able to go out. So let's
Right.
whenever we actually all go back to places, or we get to just lighten up a little bit. It'd be nice to get hassled a little bit less, but
Agreed. And like in Canada, in a lot of places in Canada with their nationwide legalization, it's kind of treated like cigarettes. A lot of places, not every single province, but a lot of places, wherever you can smoke tobacco, you can smoke cannabis, which I think is really, really swell.
yeah, no, it definitely is. And that's the way the letter of the law is interpreted a lot of times in California. But again, it's case by case, establishment by establishment on who actually allows that or thinks it's okay.
Right. Absolutely.
So I have here, in an article you published with High Times, you discussed how to make first-time users' experiences more enjoyable. Do you still find that you have first-time consumers in your social circles? And what do you feel is most important that you can do for someone's first time or reintroducing someone to cannabis?
Um, so to answer the first question, if there are still people in my social circle or just my life who are first time consumers or, kind of curious, as we like to say, absolutely. Especially back in the Midwest. And, I grew up in Wisconsin, which, there's still really no form of legalization or decriminalization there. So, but people are, thinking about it and they're curious about it. And so I always tell people to really consider and to think about what their ideal outcomes would be. So what are you looking to get out of your experience with cannabis? Are you looking to be social? Are you looking to be creative? Are you looking to have a better sleep experience? Are you having some sort of pain or health condition that you're trying to mitigate? Whatever that is will kind of help with the, what do I want to say? By understanding what your goal is with the plant, you're better able to ascertain what's going to happen and pick the product that's right for you. So I always tell people, consider that first. Are you interested in smoking it? Are you interested in vaping it? Are you interested in edibles? What does that experience look like? Obviously in the cannabis industry, we always say start low, go slow, right? When it comes to edibles, because how many times have we all heard a story about someone having a negative experience because they overdid it on edibles and it totally turns them off from cannabis completely. And that's not what we want to see. Nobody wants to see that. And so I just let people know that it's okay to ask questions. There are no stupid questions. It's a lot of overwhelming information nowadays, because the truth is that the times have changed. And so for a lot of people, especially in generations where, maybe they weren't exposed to as many different cultivars or products, that's a lot to deal with for someone for the first time. And so I always encourage people to ask lots of questions. If they're going to a dispensary for the first time, not to be shy, talk to the bud tenders, talk to the professionals that are there. Don't be afraid to research, and don't be afraid to try something new and to see what happens, but to always be safe and to always really, really start low.
Yeah, no, it shocks me how many times you've heard someone who's like, I don't like it. Well, what didn't you like about it? And it's like, what were you doing? What were you trying to accomplish on that? How do you know what you smoked is what you thought you smoked? And there's the nice thing about the California medicinal market for, how should I say, last 6-7 years before all of the legalization, there was a huge explosion in just different varietals as well as different techniques for extraction. All of those things really did advance the market incredibly rapidly. And so, like you said, it's a very different world than someone that may have even just tried something 5-10 years ago, because all the products have changed so much themselves, good and bad, I should say.
Right, absolutely. I mean, it can be dizzying, rosin versus BHO, like what is that? It's kind of a lot of jargon for some people who aren't exposed to it. And so I could understand there being some overwhelming feelings there. And so, yeah, I definitely think it's important for us too, those of us in the industry, to help educate others and to help make things a little bit more accessible. Because I think right now, there are maybe segments of the population who maybe are still a little bit anxious to try cannabis because it's just so much.
Yeah, I mean, there is a lot of negative associations people make with this plant for all sorts of reasons, good, bad, other. Our goal is to have intelligent conversations and talk that maybe some of those things are there, but if you're smoking weed that's going to make you dopey, you're going to sound dopey. There's a variety of things. If you're going to expect someone to take heavy dabs, they're probably going to be a little lit, but I've seen people that prefer CBD dabs for medicinal purposes. So there's a huge world of things available to you if you're able to actually have access to that market. When it's illicit, there is no way to access anything safely. You kind of just get what you get. And it's unfortunate that so many people are forced into that.
Yeah, definitely. And I can speak, in Minnesota and even states where we have, adult use cannabis, that the illicit market is still thriving because unfortunately there are still a lot of barriers to obtaining legal cannabis. For some people, there's a cost issue. It can be very, very expensive to buy these products, especially with certain states and certain taxes. So I totally understand that there are barriers there. Some places, maybe it's legal, but there still aren't dispensaries because of local municipalities passing ordinances. And so there are still barriers to entry for people. And so we need to be considerate of that too.
Yeah, definitely. I should say, has your, you're incredibly open and forward about it. So has that affected your hireability for non-cannabis topics when it comes to your writing? Have you
Oh,
found any hiccups because you've embraced cannabis so wholeheartedly, I should say?
well, at this point, I'm really fortunate in my career where I'm pretty much like I'm only working in cannabis. So I think the last time I took any work outside of cannabis was probably several years ago, and it was for a company that provided deck building supplies. So you want to build a new deck or a pergola on your property.
Right.
I was doing a little bit of copywriting there, but fortunately, just because of the way that the world has shifted, I've only been getting praise for my work. And I mean, don't get me wrong, there was pushback, initially when I started in this space, particularly in, where I'm from. There's still a lot of stigma associated with cannabis, and people kind of thought I was crazy. Like, what are you doing? What are you getting involved with? This obsession with marijuana? What's going on here? I don't trust it. But now it's completely changed. People are asking me about CBD. They're asking me about Rick Simpson oil. What can I share with them? It's actually been a beautifully enlightening thing because I'm able to live my truth. And not everyone can say that. And it's extremely special and extremely important and extremely humbling. And I take it as a blessing every day. And that's why I continue moving forward with this.
No, absolutely. We're incredibly lucky that we're able to do what we do. And it is only because of so much positivity that others have brought before us. So we really, really have to make sure we just keep putting it forward because that's the only way we're going to make progress.
Absolutely, 100%.
I say, like you're just talking about, how can we help change the negative associations people have with cannabis? Are your local support groups receiving pushback that's just based in blatant lies? Are they still kind of having reefer madness in moments? What is there going on in the market that you see locally?
Well, I mean, despite the fact that the governor of Minnesota would like to see adult use cannabis, and both the mayors of Minneapolis and St. Paul have expressed their support for, we're stopping enforcement essentially. And cannabis is decriminalized, essentially you can have about an ounce and a half and, you'll get a traffic citation essentially is what it equates to. But yeah, there's still pushback. The issue that we're seeing in Minnesota specifically is that, and pardon the pun, but the efforts can be a little bit disjointed. You have a lot of different people in different groups that kind of have different approaches, but there are a lot of people who are doing things right and trying to explain to the general population that this is a safe alternative to opioids for a lot of people. This is a relaxing thing for a lot of people. It's not harmful. We're not going to be, there's not going to be any sort of crazy issues with society. If we embrace this plant, we're trying to explain the economic benefits, the job creation, the tax revenue that could happen if we were to increase access to cannabis in Minnesota. And I think we're starting to see a bit of a shift. We've had adult use legalization bills introduced. They have yet to kind of move past committee, but we're trying. And I really think that after the upcoming election, we'll see kind of what the landscape will be, and also post-COVID, obviously, in Minnesota, as far as legislatively how we're going to move forward.
No, that's absolutely is how is anyone going to move forward is really the question. So a lot of us are just going to have to rely on each other in communication, because we really, really, really have to come to some sort of terms with a lot of things very quickly. Mass incarceration is horribly impractical when it comes to it, and cannabis being a horrible cause of that is just absolute waste of resources. So hopefully we can get all of that resolved far quicker than anything else.
Oh, absolutely. I mean, the damages from the war on drugs in this nation have been irreversible and frankly traumatic for so many people, and just generations of those before us who have struggled. People have died in prison. There are still people in prison today for nonviolent cannabis possession charges, and we can't forget that. And we have to see that unless we make a bigger change as an industry as far as how we want to approach the social justice narrative, we're not really going to move forward as a society in the correct manner, in my opinion.
No, that's a great way to put it. Unfortunately, we do have to move forward, because where we're at is not going to do it. So thank you so much for joining us. It's been incredible talking with you. Hopefully we can have you over here to smoke something in person, because it's been a pleasure.
I would love that. Thank you so much for having me.
Absolutely. Thankfully, Rachelle was able to spend a little bit more time with us, and the conversation turned to something that's very near and dear to both of us, and we really wanted to make sure it was included for the rest of you. Enjoy.
Just the fact that, he didn't have an opportunity to try cannabis, and it's really unfair.
No, our predatory health system is absolutely insane. I don't understand how we continually think it's okay that if someone gets sick, they deserve to lose everything, even if they survive it. Or that those bills are passed on to loved ones is absolutely insane. So I don't know. Our for-profit health system is one of the worst watershed issues I have. It's been the main focus of most of my aggression, I should say, is in political activism, is that we pay so much more as a nation for healthcare that covers far, far, far fewer people. So I don't know how we cut out that level of greed, because unfortunately there's a lot of money. Cannabis has seen it, and I think that that's unfortunately the slow popcorn effect of states is only going to make that a little worse, is if you have everybody go slowly at once, you give these corporate systems able to tackle these one at a time. And it's a weird thing. I think you would see a little bit more competition in the market if we went national all at once. And so that would be beneficial. But again, trying to bring it back to medical, the things that people have to take is insane, and the medicine isn't even working most of the time, or isn't even being manufactured to what we would call an acceptable quality. So, sorry, I didn't mean to talk over you there.
No, it's fine. I mean, the thing is that my dad never had a chance to try medical cannabis. And frankly, I do believe that his life could have been different. His struggle with epilepsy was so severe, the typical prescriptions weren't working for him. And he tried a type of surgery that can, when effective, correct the epilepsy and you're fine. But he had a massive stroke during the surgery. And while it did correct the epilepsy, it left him paralyzed and brain damaged. He never walked again. If we had known what we know now about cannabis in terms of how it can work with epilepsy, perhaps he could have at least tried it. It's not saying a guarantee that it would have worked, but he could have perhaps tried it. And perhaps he wouldn't have had the surgery. Perhaps his life couldn't have been different. It could have been different. And it's something that even later in his life, as I was getting into the cannabis industry, I talked to him about it, and he said, gee, I wonder if that could have worked for me. And it really made me sad, and it really inspires me every single day to keep going, because there are still people who don't know about the possibilities of this plant. And if I can reach one person with my writing, and they can try cannabis or have, or try it with their family member who might be suffering with something, and it changes what's going on in their lives in a positive way, then I feel like I'll have done my father a solid, essentially. Let me phrase that. If anybody can, sorry, let me start over. If I can influence any one person or their family in the ways that cannabis could potentially work for them, and they have a positive experience, I'll feel like I have done my father proud, really. And, it's a shame that he didn't have the chance to try it. And even later in his life, living in Wisconsin, cannabis is not legal there, even CBD. It's not, unless you have a prescription from a doctor. If you're living in a long-term care facility the way he was, they're not going to administer it.
Yeah.
And so even if we could have tried, for certain things, it was basically a no-go. And so it's really unfortunate how we're seeing that in our healthcare system in America, and something I personally would really like to see changed.
Thank you again for watching Highly Detailed News. Please be sure to subscribe to get more highly detailed content in the weeks ahead. Now, we understand that for most people, things are going up in smoke, but if you are fortunate enough to be able to help us end the wrongful associations with cannabis, we greatly appreciate it if you would follow the Patreon link below. Stay safe out there, and thank you again for watching Highly Detailed News.